The book makes it clear that this book does not propose how to do therapy, uh, but how to improve one's effectiveness as a therapist, no matter the approach.
Hmm.
Can you just elaborate on that?
Sure. For psychotherapists, and this may come a shock to your audiences as much as it is when I speak to groups of therapists, there really is no correlation between outcome and the particular method that clinicians practice. And our field has hundreds. About 10 to 15 or so dominate at any given time in the history of our profession, but none of them are reliably associated with outcome. None of them are reliably better than any other. So psychological care is a lot more like aspirin than it is like a, say, antibiotic. Our treatments lack specificity. That doesn't mean that they don't work, but the factors that contribute to their effectiveness fall beyond the limited techniques that the therapist may use. They depend on, for example, the therapist's ability to connect with and utilize the client's existing strengths, background, culture, and identity, to form a working relationship, to inspire hope and an expectation of change. So these are the kind of elements that a therapist can practice regardless of how they structure the language. Now, I'm not saying therapists don't need to or can't benefit from learning an approach, but it's not the techniques themselves, but the structure that those techniques provide and the expectation that they either create or not that lends to the effectiveness of the care provided.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.